I believe we're ready for the news conference now. Governor Laura Kelly, and let's go to this is the Secretary of State's ceremonial office with the comments they have live here at 422.
Of the most up-to-date information. I encourage you all to visit the website and subscribe for email updates. This situation has evolved rapidly and will continue to do so for the foreseeable future. Information is our best defense, and this resource provides our best information. We're also here this afternoon to announce critical next steps in our ongoing efforts to reduce the spread of COVID-19 and better position Kansas to combat this unprecedented emergency in the months to come. Before I walk through the details, however, I want to explain exactly why today's actions are needed. For weeks, my team of seasoned emergency management professionals has worked around the clock to adjust to rapidly evolving CDC guidance as the threat of COVID-19 has made its way across our nation and into our daily lives. We've taken painstaking efforts to proceed in ways that make sense for Kansas and respond to the unique needs of our communities. The steps we're announcing today will create the space we need at the state level to develop a more strategic, resilient infrastructure so that we can get ahead of this threat and limit its long-term impact. Those actions will come in two parts. Our response effort has been a collaborative process in Kansas from day one, and that collaboration continues with today's announcement. I am joined by Education Commissioner Randy Watson, along with representatives from the Kansas National Education Association and the Kansas Association of School Boards, to announce that I am ordering all K-12 schools to close and cease in-person instruction for the duration of the 2019-2020 school year. Administrative offices and support facilities may remain open for limited purposes in consultation with state and local authorities. Once they are thoroughly sanitized, some buildings may be reopened for small groups of school personnel charged with implementing a plan for continuous learning. This difficult decision comes after close consultation with the education professionals here today who represent local school boards, school administrators, and local teachers. The reality of this pandemic is that it cannot be controlled statewide if school buildings return to normal operations.
We've got more huge news from the State House today, as Ralph was mentioning. Governor Laura Kelly announcing an order to close all schools for the remainder of the 2019 to 2020 school year. This order impacts just under 500,000 students throughout the state, and that's both from public and private schools that this affects. But not just them, around 18,000 teachers and educators as well, many of whom will be put on paid administrative leave. Over the next few days and the next few weeks, the Kansas State Department of Education's Continuous Learning Task Force will continue their work on developing some new ways to continue education with students out of the classrooms. And Governor Laura Kelly offered these words of encouragement to the entire state.
Ad astra per aspera literally means to the stars through difficulty. Our Kansas motto has never been more appropriate, and it is through our Kansas spirit that we will overcome this challenge and emerge even stronger as a state.
The state will give school districts guidelines on how to move forward, but it'll actually be up to each individual district to come up with an education plan of their own.
We'll be talking about this story a lot more over the next few nights. The Shawnee County Health Department has had its daily news conference. That was right after the governor's news conference concerning coronavirus. And 13's Isaac French, he is live from the Shawnee County Health Department. So Isaac, what are they saying tonight about the virus and what's happening around Topeka?
Tonight, the Shawnee County Health Department touched on their home quarantine guidelines. Now, those rules are in effect for those who traveled out of state to a state where known community transmission has occurred, for those who traveled on a cruise, or for those who traveled internationally on or after March 15th. They also touched really big on calling before you go. This means if you start showing symptoms of COVID-19, to call a healthcare provider instead of showing to an emergency room and not putting others at risk. Ralph?
All right, and Isaac, thank you, sir. I want to pass along this update also. We had our first case in Douglas County in Lawrence, one case there, bringing the total to 16 now, a young man in his 20s who traveled back here from Florida. A lot of you are worried about COVID-19, about being tested to see if you might have it. Right now, testing isn't an option for everybody. 13's Danielle Martin is back, and she's in the newsroom after talking with a local pathologist about the testing qualifications.
Ralph, as the number of cases grow, Dr. Richard Gomez says the qualifications for who may get tested for COVID-19 become critical. He said the step is to communicate with your primary physician. Stormontville opened a drive-through testing clinic for COVID-19 Tuesday, but not just anyone can pull up. Doctors must approve the test, and the first criteria are symptoms.
Currently, the testing is if you have symptoms of a fever, a dry cough, or any upper respiratory symptoms, you should call your physician or your provider. Even symptoms don't guarantee a test. We do have a priority system here. So people like you think are in the hospital right now, in the intensive care units that need the testing done, they're the first priority. The next priority might be someone that's been in contact with a known patient is positive also. Dr. Gomez says they have noticed something during their testing process. If someone has symptoms they think might be COVID, the odds are now we're finding more often those individuals might be testing positive for the flu virus. That's why the governments, local and national, are asking everybody to limit contact for the next few weeks. Dr. Gomez says there will be enough tests for everyone who needs one. Now laboratories like Quest and LabCorp and some hospital laboratories have been able to bring the test up, but it's going to be a gradual time of increasing test availability, and that's the other reason why we want to make sure that criteria for testing is followed. He also reminds you of other resources while hospitals and clinics are busy. Some clinics, because of the heavy phone volume, have gone to doing telemedicine, which means you can go online. Again, you must call your doctor first to discuss symptoms before going anywhere. If you do meet the CDC criteria for testing, you'll be directed to Stormont's drive-through clinic or any other location. We have details on that on WRHS.com. Ralph.
Danielle, appreciate that. So once again, same scenario. Call ahead before you go. Danielle, we appreciate that. Keeping your family safe from all this means your furry family members too. And Melissa asked a local veterinarian, Allison Crow, whether that means do we keep our distance from our pets or are we still okay to cuddle up a little bit?
If you're worried COVID-19 will keep you from playtime, there's good news.
There is no hard evidence that pets can get infected or that pets pose a risk to us.
Veterinarian Allison Crow with the Animal Clinic of North Topeka said the only positive case in a pet so far was a dog in Hong Kong.
They tested that dog initially at the end of February.
Other tests on cats and dogs have been negative. So right now, the only CDC guideline is for people confirmed positive for COVID-19.
The recommendation is, if you can, to have them cared for by someone who isn't sick and to isolate yourself from your pets just the same way that you would try to isolate yourself from other humans as well.
Dr. Crow also reminds you to keep pets in mind with any cleaning you might be doing.
A lot of cleaners do have toxicity effects on dogs and cats, so it is important to make sure you're diluting any cleaning product the way that it's supposed to be according to directions. And if you are using especially something that is a bleach derivative, that you're giving that time to dry adequately before you allow pets to have exposure to that space.
While looking out for their health, pets can be important to your health too, as many of us stick closer to home.
They provide amazing emotional support during a time when I think there's a lot of unknowns, a lot of extra anxiety to life. I think giving them extra hugs and love is especially needed during this time to keep us all a little more sane.
Melissa Bruner, 13 News.
At home, reporting for us tonight, Dr. Crow says pets can be a contact surface for spreading germs. For example, if somebody sneezes or coughs on them, and you touch their fur, keep on washing those hands often, especially after that. Grant?
Both Hayden and Washburn Rural High Schools recently took groups of students on trips before the coronavirus was widely spread in the U.S. Both schools released statements on the health of their students and the staff members too. Washburn Rural's Directors of Communication, Martin Weishar, says that they have, quote, shared information about the rules related to travel with all parents and staff. I believe the students and adults have followed all health recommendations before, during, and after the trip, end quote. Officials from HAYDEN High School, whose students also recently went on a trip, said, quote, there were representatives of HAYDEN Band and Cheer that did travel to Florida, and that they have a specific area for our COVID-19 HAYDEN updates and responses, end quote. Now, that resource is haydencatholic.org, which you can find a link to that website on ours, WIBW.com. Topeka Public Schools is joining the list of places providing school lunches to kids while classes are still canceled. Starting today, TPS Food Service will be providing grab-and-go meals for kids. Those meals served between 11 and 12 every weekday until March 27th. Students under 18 years old can get one meal per day. The meals are being distributed from 13 different 501 schools, and a full list of those schools can be found on WIBW.com. Families will also be able to find lunches for their kids from the Salvation Army. Salvation Army giving out sack lunches at 3 different locations all around Topeka. They plan on providing these lunches through March 27th. They will have 150 meals at each stop, which are Timberlea Apartments at 341 Southeast Lawrence, Deer Creek Housing Units at 423 Southeast California, and Pine Ridge Apartments at 2010 Southeast California.
Amid all these concerns, Riley County Health Department staffers are not advising bars or restaurants around Manhattan to close right now. The officials there also remind everybody of the proper hand washing with soap and water for 20 seconds and use those alcohol-based hand sanitizers with at least 60% alcohol content. They are encouraging the practice of social distancing. So once again, they would like to see those bars and restaurants remain open as long as possible. Some businesses around Manhattan have made adjustments, allowing them to continue to stay open while observing those social distancing suggestions.
We realize that some restaurants have shut down their interior space and just have gone to drive-through, and we applaud those efforts because that really helps to reduce the risk of exposure.
Riley County Health reporting they're willing to provide proper signs to the bar and restaurant owners who really need them. Top story tonight here at 10. The Shawnee County Health Department late tonight has ordered all the bars and restaurants and clubs and theaters to close. Restaurants closing their dining rooms in particular, the bars too. Grant Stevens, he's live downtown with the full story of this. And Grant, what do we know about this so far?
Shawnee County was forced to make yet another very tough decision tonight, deciding to close all restaurants and bars indefinitely. We've seen this in Kansas City, we saw this in Lawrence, but now this hits closer to home. This is all being done to stop the spread of the coronavirus and to really mitigate the risks surrounding this. We haven't seen our first case yet here in Shawnee County, but this is being done to prevent that, or at least prolong that for as long as we can. Now, of course, this doesn't completely cripple the restaurants, and it won't completely end the business practices here in Shawnee County. You can still get carryout or takeout, or you just can't dine in. You can dine out, but you just will not be allowed to dine within the facilities. Now, we've been following this for a long time now, and we'll continue following this. We're expecting to hear a little bit more about this from Shawnee County officials in a press conference that'll be happening at 8 a.m. tomorrow. But again, all of the restaurants, all of the bars, anything like that within Shawnee County will be forced to shut down their dining operations starting at 12:01 tonight. Again, we'll have more information tomorrow morning, and we'll have you fully up to date on WIBW.com. Ralph?
Thank you.
You're watching 13 News, Kansas News Leader.
Good evening and welcome into 13 News at 6. I'm Melissa Bruner. We'll check in with Ralph Hipp a little bit later. Moments ago, Shawnee County announced its first 3 residents testing positive for COVID-19. 2 went to Stormont Vale, 1 to St. Francis. Also, Jefferson County says they too have their first confirmed case, and Lyon County has 2 more cases today. That's a total of 4 for Lyon County. Now, those cases are in addition to the 126 that you see reflected on the Kansas Department of Health and Environment's website. This number here is up 28 from yesterday, so 33 cases more today. The state also saw its 3rd death yesterday. That was reported in a man in his 70s from Wyandotte County. You can see the counties still, the eastern portion of the state mainly affected, and if you looked at the trajectory of cases, here it is going up. Kansas also, by the way, has gotten more than 2,300 negative test results. Now, the news in Shawnee County comes just hours before a stay-at-home order takes effect here. Let's go to 13's Isaac French. He just heard the update from health officials and is live to begin our team coverage tonight.
The Shawnee County Health Department announced that there are now 3 positive cases in Shawnee County. 2 of those patients are currently being treated at Stormontville Hospital. Now we are told that they are both male, one in his 20s and one in his 70s, who both recently traveled out of state. That 3rd patient is being treated in St. Francis, and we are told that is also a male in his 70s who has no recent history of travel. Now, the health department also wants to remind the public that that stay-at-home order does go into effect tonight at midnight. Melissa?
Isaac, thank you very much. And that stay-at-home order, by the way, means only leaving your home for essential tasks like getting food or health care or caring for a loved one. Lyon and Coffee counties were among the latest announcing stay-at-home orders. Shawnee counties again takes effect at midnight. A lot of you have been asking how this will be enforced. We reached out to Topeka Police, the Shawnee County Sheriff's Office, and Kansas Highway Patrol. They say if you're involved in a regular traffic stop, they may ask where you're headed, as they usually do, but they will not initiate car stops solely to enforce the order. They also will not ask for any special identification or paperwork. They say if that happens, you should call 911. They're trusting all of us to do our part.
This community's been great. People have been complying. Everyone wants to be safe, do the correct things. The enforcement actions as they come out by law, we have to enforce these health directives. But we've had very good compliance by our citizens here.
Authorities say they'll be stepping in to break up gatherings of more than 10 people if needed. By the way, the Shawnee County Health Department and emergency management staff will be holding a Facebook Live Q&A because they know there are so many questions about it. That is getting underway right now on the Health Department and the Shawnee County COVID-19 Update Facebook pages. While more than half the state's residents are now under local stay-at-home orders, Governor Laura Kelly is not ready to issue a broader mandate. Is there a need for a statewide stay-at-home order?
I don't believe there is at this very moment. You know, clearly our local officials are making those decisions, and we are supporting those decisions. We are monitoring very closely. You know, I do not want to put anybody at risk.
Governor Laura Kelly said more than 80 of the state's 105 counties have no COVID-19 cases right now, but she says a nationwide shortage of test kits has put restrictions on who gets tested. How do you make these decisions when it could be said you really don't know what the situation actually is?
We don't know because we're not able to test everybody. So we never will know that. You know, in no situation would you ever have any doubt. So I am relying upon my medical experts primarily to, tell me when it's time to pull the trigger.
With coronavirus concerns closing so many businesses, unemployment filings in Kansas skyrocketed to nearly 28,000 last week, up from 1,300 2 weeks earlier. It's overwhelmed the state labor department's phone lines and website. The governor said they are working to add capacity and staff to get calls answered.
We know it's a problem. It's a problem everywhere. Nobody was equipped to handle this volume all at once.
Kelly said lawmakers approved her executive orders to support Kansans, and the federal stimulus should do even more. But she called hopes of a recovery by Easter wishful thinking.
I think anybody who starts planning for that short of frame time will run into a lot of problems. I think we need to be thinking of this in a very long-term way.
How long-term?
I don't know. You know, that's the problem, is we really don't know. We have never faced anything like this before.
Governor Kelly today also signed the state's budget. It includes $65 million to support coronavirus response efforts, things like helping with equipment and supplies for emergency management.
Well, good morning, everybody. Hello across Kansas. It has been another full week in our battle against the coronavirus here in Kansas. We've requested a federal emergency disaster declaration so that we can access additional resources. We temporarily prohibited mass gatherings of 10 or more so that we can continue to flatten the curve. We're actively exploring additional private sector options to help us scale up our testing capacity as quickly as possible. These decisive but necessary steps have absolutely helped slow the spread of the virus, but unfortunately, they're not enough. Our projections continue to suggest that the number of confirmed positive coronavirus cases in Kansas could reach as much as 900 over the next week. Positive cases are appearing everywhere at this point, not just Johnson, Wyandotte, and Sedgwick County. This week, we also saw our first confirmed case in Gove County in northwest Kansas, and we expect to see more in the days ahead in these areas. Therefore, this morning, I am announcing the difficult but unavoidable decision to add Kansas to the list of 22 other states that have issued a temporary stay-home order. By Executive Order 2016, Kansas will establish a stay-home order in conjunction with the Kansas Essential Function Framework for COVID-19 response efforts. This will take effect at 12:01 on Monday, March 30th, and last at least through Sunday, April 19th. I reached this decision in close consultation with the State Health Department, the State Emergency Management Division, and our local and federal partners.
Well, he doesn't exactly fit the typical picture of who you might think is a seriously ill patient, and that is exactly why a Silver Lake native's family wants you to hear his story. In a matter of days, Eric Goodman went from healthy 43-year-old to fighting for his life.
He's just a fun guy.
In a family where even grandma gets in on the antics, Eric Goodman can clown with the best of them.
Just to tell you, his nickname in high school, and he's going to tell me when he watches this later, is Goofy.
His sister Anya says that's why it's so hard to believe this former Silver Lake High School cross-country runner, a husband and father of two, is now living this stark reality.
And there's just not really a whole lot that prepares you to see a loved one with a tube down their throat and laying there what looks like to be lifeless.
Anya says it started a little over 2 weeks ago. Eric woke up not feeling right and had a fever. He tested positive for COVID-19, spent a few days at the hospital, then went home to recover. But a few days later, he woke up and couldn't breathe. His wife and younger son rushed him to the hospital near their home in Shawnee.
I had to just drop him off at the front door because they weren't allowed to go in. And then they immediately sedated him, intubated him, and put him on the ventilator. And that has been 10 days ago at this point. My sister-in-law hasn't spoken to him, had a conversation with him in 10 days. My nephews haven't talked to their dad in 10 days.
Which gets to the heart of why the family wants to share Eric's story.
I want people to understand that he was a healthy 43-year-old active guy who is literally fighting for his life. And it's not, an older person in a nursing home. It's not somebody who is immunosuppressed, just a regular, healthy, middle-aged man. And that's why it's so important that we follow the directives of our government. We follow the directives of the CDC and stay home and do our part to stop the spread so that it's not your loved one that you have to see in the hospital like we do.
They've allowed Eric's wife 2 brief visits. The good news is doctors say he should recover. They just don't know how long it will take.
And they've told us that it's a marathon, not a sprint. Man, I wish I knew what mile marker we were at.
And when he does cross that finish line to recovery?
What's the first thing you want to say to your brother?
That I love him. And that I'm really thankful for him.
And he is expected to recover again. They just don't know the timeline. Eric's sons are 18 and 20. Anya says the older boy was actually at college when Dad got sick, so he's been staying with friends because his mom and brother are quarantined. Topeka's Stormont Vail is cutting pay for non-patient care staff as it deals with its COVID-19 response. In an email to employees this evening, their CEO, Dr. Robert Kanegi, said their new workforce plan strives to provide a paycheck for all workers. However, he said the coronavirus pandemic is, quote, greatly disrupting our organization's financial foundation, end quote. Staff is being trained to move into areas of critical need, and some may be reassigned to new roles. As for the pay, employees who are not working will have pay cut in half staff, with no one dropped below $12.45 an hour. The CEO, Dr. Carnegie, will take a 35% pay cut. The hospital's senior vice presidents will drop 25%, vice presidents 20%, administrative directors 15%, and those working in non-patient facing roles or working from home will earn 10% less. Employees in those face-to-face patient care roles will see no pay cut. That plan is effective April 5th. Carnegie says they'll review it every 30 days as the situation continues. By the way, I also reached out to St. Francis Topeka tonight. A spokesperson there says with declines in routine and elective procedures, they are flexing and cross-training staff as needed.
News leader.
A special celebration today led a Topeka man out of the hospital and into the arms of his beloved wife for a special reunion after the pair had both overcome the challenge of a lifetime. These are Dwight Patterson's first steps out of St. Francis Hospital in 6 weeks. After being on a ventilator in the ICU, the 63-year-old Topekan has beaten COVID-19.
Just thankful. I'm just thankful. I'm just full right now.
Waiting with open arms in a parade full of nurses and hospital staff was his wife of nearly 40 years.
Love you.
Ruth.
She's my junior high school sweetheart. We've been together since we were 12 years old.
Ruth knows exactly what it's like to fight the virus. She had just returned from a month-long hospital stay herself, fighting COVID-19 the day Dwight collapsed.
And I hadn't even unpacked bags. I hadn't even really sat down too much when all this began to occur.
This could have been the last time we saw each other. She just got home and I had to turn around and go 5 minutes later.
The last time I seen him was when the ambulance was rolling him out.
That was 6 weeks ago.
My honey is back. And I can embrace him and squeeze him and hold him and knowing that he's going to be all right.
When I leave here and walk out that door, life is still changed. This thing is real. People are dying from this every day. So we need to just be thankful for the everyday things we take for granted.
The complete healing process may take longer, but we'll get through it together.
Dwight says the first thing he's going to do when he gets home is pray and reflect with his junior high school sweetheart, his wife, and fellow COVID-19 survivor, Ruth.
The toll the COVID-19 pandemic is having on businesses and workers is shown in the state's unemployment numbers. Take a look at the bar graph. A lot of you have been asking about this topic. This week last year, the Kansas Department of Labor has seen only about 1,500 people file unemployment claims. The week ending March 14th of this year, it was around 1,800. Fast forward a week after that, the coronavirus cases started climbing, businesses started closing, and nearly 24,000 people filed claims the week ending March 21st. Last week, the week ending the 28th, 55,000 claims. By the way, this represents a year-to-year increase of more than 3,500%. It is also why so many of you are getting busy signals or being put on hold when you try calling. The Department of Labor gave us a little bit of information today. They received 877,000 call attempts to their unemployment line Monday alone. Before the COVID crisis, they had about 1,100 calls that they averaged a week. Today, the Labor Department told us a couple things they have done. They have increased the number of phone lines to 200, and they have added 40 intake workers. They are also training more staff from other areas to get more people on board. They also fixed a glitch today that was telling many of you filers you still had to wait a week for benefits. That was waived, so don't worry if you got that message. Also, they added a button online today. Several of you asked me about this. You can get your username and password recovered online. Some of you contacted me saying, I don't have it. I can't get through on the phone lines. You can now get it online. Labor officials say online continues to be the best way to file your claim. And again, that web address, getkansasbenefits.gov. Make sure it says .gov.
The sheer capacity, no one in this country or this world knew that this was going to happen. So we will continue working with you. We will continue listening to you. We see you. We hear you. We will get through this together. It will take a partnership.
Secretary Garcia also said during this Facebook Live session today they're waiting for federal guidance on how those of you who are self-employed will sign up for those special pandemic unemployment benefits. She suggests you apply for the regular benefits now. It will be denied. It will be denied, but then your claim will be on file for when the pandemic benefits process is set. Take note of this. The Department of Commerce launched a new website today to help job seekers during the COVID-19 pandemic. It's kansasworks.com/coronavirus. coronavirus. It lets employers from essential businesses to post positions they need to fill to help with the COVID-19 response. The site is free and will be updated continuously. We also have a page of available jobs in the region on WIBW.com. Now on to the unemployment issue. With the claims continuing to soar, the state's phone lines and website to handle those calls have been down since yesterday. 13's Marlia Campbell has been pushing state leaders for answers to this. And Marlia, you also talked to 3 Kansans about what they have been experiencing.
Yeah, Melissa, in our afternoon news conference, Governor Laura Kelly said the site was back up and running, but we found the error messages continuing. State officials keep saying to be patient, but the message is wearing thin for people trying to file.
I've been working on this since March 18th, and I haven't seen any unemployment check come through yet.
This is the reality of trying to file for unemployment benefits for the thousands of Kansans without work due to the COVID-19 pandemic.
I've had plenty of food for a while, and now we're starting to get depleted, and I don't know what the heck I'm going to do about getting the next batch of groceries.
I have about 8 medications I'm on daily that I have no insurance to pay for. I have enough to get through this month, but I don't know.
The frustrations lie with an overwhelmed system through the Kansas Department of Labor, flooded with a record-setting number of calls.
Oh, God, countless. I can't even, to make an estimation, I would say on the phone, probably 20 hours. I mean, I would literally spend 2 to 3 a day of listening to it busy.
A year ago, the Kansas Department of Labor saw 1,500 claims a week. 55,000 came in the week ending March 28th, 50,000 the week ending April 4th. Last week's numbers aren't in yet. Prior to the pandemic, 20 people were waiting to take those calls. Now, the Department of Labor has brought in more than 100 to assist, but the lines are still backlogged.
We know that it's been difficult to get through to the phone lines, which is why we've been encouraging people to go to the website.
This weekend, though, website visitors were met with this.
You know, when you call in, they refer you to the website. Well, the website's not working.
The Labor Department reminds you that you have all week to file your weekly unemployment claim, and again, asks you to keep calling, checking online, and staying patient.
Marlia, thanks. And I know we both tried logging on again before we came out here for the news tonight just to see if it was working, and still getting those not found or site under maintenance messages still tonight. Shawnee County has some new recommendations to keep stores safe. Health Officer Dr. Gianfranco Pizzino sent a letter to retailers in the county today. It outlines 8 safety measures he strongly recommends stores should take. Social distancing is a common thread. He recommends monitoring customers in the stores and parking lots, using floor markers to show safe distance, and keeping workers at a good distance from customers. He also suggests cleaning shopping carts and having hand sanitizer available throughout the stores. Finally, Dr. Pizzino recommends staff wear masks and stores install plexiglass barriers at checkout lanes if feasible. Again, those are not requirements, but things he strongly recommends. Good evening and welcome to our special extended coverage tonight. Governor Laura Kelly will reveal her plan for reopening Kansas in just about a minute from now. A statewide stay-at-home order ends Sunday night, but both Governor Kelly and Kansas Department of Health and Environment Secretary Dr. Lee Norman have said that does not mean right back to business as usual. They've both hinted at some continued social distancing in order to help continue to flatten the curve. But what does that mean for how we do business? Restaurants, for example, have been limited to drive-through and carry-out only. They want to know how quickly people might be able to come back inside. Stores that do not sell essential items, many have closed their doors. How soon might customers return there? What about weddings, funerals, graduation parties? The larger gatherings have been a big question mark as health officials have talked about how quickly we might be able to return to our regular habits of living. The governor may shed some light on that. What we do know is that the economy has been taking a hit through all of this. Jobless claims continue to be on record pace, starting to level out in Kansas, but again, still above the norm. Regardless of what the governor says tonight, county health officials have stressed do not expect a free-for-all come Sunday night. With no state order, authority goes back to the counties. Johnson and Wyandotte counties already have said they're extending their stay-at-home orders another week through May 10th. The governor's remarks tonight are coming from a film studio in downtown Topeka. No news reporters allowed. It is the governor by herself taking a podium as we prepare to hear from Governor Laura Kelly on her plans for reopening the state of Kansas. Business leaders have been wondering exactly what will take place, what adjustments they will have to continue to make. There have been some places that have reopened amid different policies such as face masks and whether we will be required to wear those if we go to certain places. We continue to monitor. The governor was to begin speaking in just a moment. Again, this is from a film studio in downtown Topeka. Let's hear from Governor Laura Kelly on how we will go about reopening Kansas.
Good evening, fellow Kansans. Thank you for tuning in tonight as I outline the next steps of our coronavirus response efforts in Kansas. I also want to extend my appreciation to our broadcasting networks for providing this platform so the people of our state can hear about these plans directly in full. We've been through quite an ordeal these last 2 months. The breadth of change we've all been once again. Ad astra per aspera. And to all the people of Kansas, God bless you, and God bless our great state of Kansas.
Governor Laura Kelly outlining her plan for reopening Kansas. She outlined several phases for this plan. Of immediacy is phase 1, which would get underway Monday. The statewide stay-at-home order expires Sunday night into Monday morning. Phase 1 begins then, and the state restrictions under phase 1 continue to be mass gatherings, no more than 10 people allowed to gather at once. You are encouraged to maintain that 6-foot social distance, strongly encouraged to wear a mask in public, telework encouraged to continue, also minimize or avoid any non-essential travel. Activities that will still not be allowed in phase 1 of the state's plan: community centers, large entertainment venues with capacities greater than 2,000, fairs, festivals, parades, and graduations, public swimming pools, organized sports facilities, summer camps. Businesses still not allowed to open come Monday. Bars and nightclubs, except for any curbside service they have operating. Non-tribal casinos, indoor leisure spaces, fitness centers and gyms, and personal services, including nail salons, hair salons, barbershops, and tattoo parlors. Again, this, according to the governor, is considered to be a framework. It is a suggestion, and counties are encouraged to set their own restrictions as they see fit. We've already heard from several counties who do expect to make statements tomorrow. Shawnee County, Riley County, Geary County are going to be making some comments tomorrow on how these comments tonight impact what they will have in place locally come Monday. We already know that Johnson County and Wyandotte County are going to extend their stay-at-home orders for another week through May 10th. Remains to be seen what's going to be happening locally. You can view the entire plan, by the way, at covid.ks.gov. It's right there on your screen. Even if we do everything perfectly, Governor Kelly said, we are still subject to the whims of the virus. We are still studying how it behaves. They have been pleased with how they've been able to ramp up the testing supply that we have across the state of Kansas, and they will continue to be getting more of that. We heard today that they are going to be testing all of the inmates at Lansing Correctional Facility where they are dealing with an outbreak. And in fact, they did test all 240 inmates who are in one area of the facility. The preliminary testing shows that up to 75% of them tested positive, but were showing no symptoms. And that's an example of what Governor Kelly was alluding to in her comments this evening, that we know with so many asymptomatic people, there is risk that people are continuing to spread without knowing that they're infected and without knowing that they are out there spreading the virus. So that is where the testing component of this comes into play. As part of the phase, Governor Kelly announced tonight that the Kansas Department of Health and Environment is already recruiting and has already begun training 400 people for contact tracing. What that is if somebody tests positive for COVID-19, the contact tracers will go to work, much like they actually have been doing in the counties already. When someone tests positive, they want to know who that person has come in contact with, so then those people can be on guard so they don't unwittingly spread it throughout their communities. It is a 4-component plan initially: wide-scale rapid testing across the state, protecting the capacity of the public health structure, ensure that exposed Kansans have a safe place to quarantine, and then again, that contact tracing program that I mentioned. You can read the entire plan. Again, it's covid.ks.gov. We will continue to get reaction to this, and we'll wrap up the plan for reopening the state of Kansas from Governor Laura Kelly on your late local news tonight at 10. Read more on WIBW.com right now, and we'll return you to your local programming. Have a good night.